I've been a medic with AMR in San Diego for the last 30 years. I've responded to thousands of emergency calls, from cardiac arrest to overdoses. Since the 1950s, AMR has been working in the San Diego region. And today, we are the largest and strongest EMS provider, not only regionally, but across the country. I am very proud to be part of this dynamic and dedicated team.
For us, it's more than just responding to calls. It's about being there when our cities need us, like during the COVID-19 crisis. Whether it's transporting homeless individuals to safe shelters or providing care at the Miramar quarantine facility, AMR has been an all-in team player, helping out whenever and wherever we're needed.
You know, AMR has been an outstanding partner and friend Alpha Project for years and years and years. They do things like vaccines for our residents, CPR training for our staff, transportation that doesn't exist for our clients. They've been on the front lines with us every single day throughout San Diego with the response to COVID-19. They're up front and personal every day, in the trenches every day with us, and we just couldn't do it without them. We're just so grateful to have them as friends and partners.
At Family Health Centers of San Diego, we see more than 25,000 homeless individuals every year. And one of the biggest barriers they have to care is transportation. We talked to our friends at AMR about this barrier, and they were able to donate a 10-passenger van that we reutilize now in order to transport these homeless individuals to their appointments at our health centers. Their medical care, mental health care, dental, vision, the whole panoply of medical services. We're extremely grateful to AMR for this very generous donation.
My daughter Melina is a total dependent child. She got meningitis when she was 5 weeks old, so she had 3 strokes. As Melina got older, her medical needs became unstable as far as her vital signs. So that's when I made the decision that it would be best that she got placed at a facility. There was a great opportunity that AMR offered during the holidays, and when I got the call that we were chosen, I was very excited and pretty much started crying and knew that it was going to be a special moment. Being able to come home for Christmas meant so much to Melina and our family. She was so happy, and her dog Minnie was very excited. They were both excited. They're pretty close in age, so they grew up together, and Minnie really enjoys spending time with her. They're pals. We're just all very grateful for the whole experience. It was amazing.
Today more than ever, American Medical Response Management and crews have been an essential part of our local healthcare system, working collaboratively with hospitals, public health agencies, and medical partners to provide care to San Diegans at a moment's notice. AMR continues to be there for San Diego, and the San Diego County Medical Society is proud to endorse American Medical Response.
AMR has a long history of community service in San Diego and has shown strong support for San Diego Pride, generously providing on-site medical aid to our attendees over the years.
When it comes to racial equity, AMR is very proud of its record. From our culturally diverse workforce to our response time compliance in every community in San Diego. In our proposal, we take this commitment to the next level by proposing, among other things, a new ambulance station in the southeastern part of the city's central zone. It will house at least 1 new ambulance 24 hours a day.
I've worked for AMR and the predecessor company since I was a teenager. I started as an EMT and worked through the ranks. I've been part of just about every major EMS response over the past 40 years in San Diego, from the PSA crash in 1978 to the Brenda Spencer shooting, the McDonald's shooting, and most recently the hepatitis A and the COVID outbreaks. As the regional director for AMR, I am so proud of the work our people have done caring for the citizens of San Diego in the time of need and crisis. We've also made it our mission to support organizations that make a difference in the communities we serve, such as the YMCA, the Boys and Girls Club, Alpha Project, the Burn Institute, Family Health Centers, just to name a few.
AMR has proudly served the San Diego region with ambulance service for more than 70 years. In 2015, we acquired Rural Metro Ambulance, who was the city's provider at that time. As you may recall, they were facing bankruptcy, had a fractured relationship with their workforce, and were facing very serious response time problems. we immediately met with the city, its fire rescue department, and the workforce in order to begin to stabilize the system. We rekindled those relationships with the workforce, giving them much needed raises, benefits, and improvements in working conditions. Since taking over the system, we have invested millions of dollars in technology, and we've grown our fleet and our workforce in order to keep up with the growing needs and demands of this vibrant city. I think we can all agree that today's EMS system is strong, stable, and better than ever.
Hello San Diego, my name is Ted Van Horn. I'm the Chief Operating Officer for Global Medical Response, the parent company for AMR. I myself is a paramedic in New York, in Arizona, Southern California, and Texas. Global Medical Response has 38,000 employees of operations for helicopter services, jets, ground ambulances, managed transportation, technology, wildfires. All those employees come together for times like what we're dealing with now with COVID, or for other disasters or emergencies that happen that are unforeseen. Our company evolves around that, works with the local communities to do everything we can to make sure the employees, the patients, the customers that we service are there for you at a moment's notice. We are proud for what we've been able to do in San Diego, putting the EMS system back on track. EMS systems are one that are developed around the individual community. We've done a lot to make sure our systems, our management team, the service we provide to San Diego is evolving with time. And we do know that the new structure, the new RFP, is going to need the next evolution. And we're excited to be able to put forward a proposal I think that you'll be very pleased with.